Okay, Daniel, we can start.
Okay. A hearty welcome to all of you from the Internal Quality Assurance Cell of Srinarana Law College, Puthota, Ernakulam. Good evening, all. I am Tanya Tom, the student coordinator of the IQAC cell of our college. Today's webinar is on a very important topic, psychiatric probe among youth. Uh, we have as a resource person Dr. Arun B. Nair, MBBS MD, a very eminent consultant psychiatrist, associate professor at Government Medical College, Thiruvananthapuram. He is an author of 15 books, including Live, Learn, Look Bright, and Advances in Psychiatry and Medicine. He has conducted over 1,000 episodes of health and social awareness programs in various TV channels. He has authored numerous articles on health, mental health, and social issues. He is also the recipient of many awards, Vocational Excellence Award of Rotary International and Nammude Arogyam Award of IMA, and also the Social Media Award and Mind Award by the Center of Excellence over the years. He is a guest faculty at Child Development Center Trivandrum. He devised empowerment of caretakers of rehabilitation centers for mentally ill all over Kerala. We are indeed to have such an eminent person as our resource person today, Law College. Welcome, sir. I also welcome our principal, vice principal, management, staff, teachers, and students of our college today. We also have in our midst other teachers, academicians, faculty members, students, and other participants interested in this topic. I welcome you all on behalf of the IQAC of Srinarayana, and I'm sure that all of you will benefit from this informative session. The session will be for 45 minutes, after which we will have a question and answer session. To avoid any sort of interruption during the session, please make sure that you mute yourself. Kindly mute yourself. It is a gentle reminder that any disruption of the webinar will cause your removal. Also, kindly use the chat box to post your questions while the session is on. And as said earlier, it will be answered individually by a resource person to save time. I will also be putting these questions individually towards sir at the end. E-certificates will be provided upon feedback submission. The feedback link will be put up in the chat box. I now invite our beloved principal, Dr. Raghunathan sir, to kindly speak a few words to the gathering.
Okay, good evening to all. Today we are gathered here in this online platform to discuss about the topic a psychiatric probe among youth, which is very relevant in the present scenario. This era has seen massive boost in the educational system, and the present day youth have various options and opportunities to select from for their future. But the grassroots problem that has arisen in between all of this is the anxiety, apprehension, and mental depression faced by our youth. Students, especially, fall prey to this because of the education system demanding good results, plus the added burden of expectation they have to fulfill. Furthermore, during this coronavirus pandemic world, this discussion on how to cope and how to maintain your mental health status holds primary importance. So today, I am honored to welcome Dr. Arun B. Nair, Associate Professor, Government Medical College, Trivandrum, to enlighten you all with his words and also to help you to realize the significance of mental health in youth. And I am sure that this seminar will be benefited. You can ask your doubts, you can clarify your doubts, and make this webinar a fruitful one. Thank you.
Thank you, sir. I now invite our resource person to start off with the session. Over to you, sir.
Thank you very much for those kind introductory words. My sincere gratitude to Dr. Raghunathan sir, Principal of SN Law College, and the other organizers of this program for giving me this great opportunity to address the group of budding lawyers and, budding judicial officers of our country. So it's indeed a great pleasure to talk to you in this evening about the relevance of mental health in this pandemic era. We have been using the term post-pandemic era during the initial phase of the pandemic, but now we realize in a very difficult way that this pandemic is going to persist for a long period of time. So the term post-pandemic era may not be relevant until probably a few months or maybe up to a couple of years. So living with the pandemic, so the pandemic era is a more useful or appropriate term than post-pandemic era. So we have seen that in 1918, when the previous pandemic of Spanish flu hit the world, the pandemic went on for around a year. It affected lakhs and lakhs of people all over the world, including the Indian subcontinent. Many people died. But one fine morning, the virus disappeared just like that, without any kind of intervention from human beings. But what followed after the disappearance of the virus is referred to as the Great Depression in the history of modern world. Every sector in the world collapsed like anything as a result of that pandemic. The agricultural sector, industry sector, the organized sector, the education sector, the finance sector, all over the world, everything collapsed into pits. So the world was seeing huge amount of mental health issues, large number of suicides, quite a lot of depression, and large number of drug addiction, substance addiction kind of things also. That is why that era is referred to as the era of Great Depression. So just like that, this pandemic is also putting forward certain apprehensions in our mind, because in the first 3 months of the lockdown itself in Kerala, 66 suicides in children less than 18 years of age occurred. So these suicides occurred when children were sitting at home, which is supposed to be the most safe, secure and comfortable place for children to be in. We thought that children are stressed due to academic reasons, and most of the stresses of these children happen outside the home. So they were very happily sitting at home. We thought that everything would be contained and controlled, but still, despite that, suicides were happening. And that is what made us thinking about the relevance of mental health. So one important data is that 50% of all mental illnesses start before 14 years of age. And 75% of all mental illnesses start before 24 years of age. That is the relevance of this topic. Identifying behavioral problems, mental health problems at the earliest, in the young age itself, and appropriately addressing them will cure many of those mental illnesses and will prevent many other mental illnesses from running a chronic course. So if we identify and treat those illnesses, a large number of people can be completely cured and we can stop medicines even. A section of the people who may be having long-standing mental illnesses also can do well in their life on treatment, lead a productive life, get gainfully employed, lead a good family life without creating any problems either to themselves, their family, or to their society. So that is the relevance of identifying this issue. In 2016, a survey was conducted in Kerala by the Kerala State Mental Health Authority. It identified that 12.8% of the total population of Kerala are suffering from at least one mental illness which needs treatment, which means 1 out of every 8 human beings in Kerala is suffering from a mental illness requiring treatment. And out of this whole population, 9% of the population were suffering from depression. And we recollect the famous statement by the World Health Organization. WHO has very rightly pointed out that depression is the commonest, worldwide prevalent, but most easily preventable cause of suicide in the world. So the statement very simply implies that if you identify and treat depression, you can not only cure that illness, you can also prevent suicides. While unidentified and untreated depression leads to suicides. So it is in this context that we are discussing about mental health. So let us answer three fundamental questions at the beginning itself. These are questions which many students have asked me whenever I go to take webinars, lectures like this in the last 6 months. Many students have asked me, what is mind? Is there an answer to that question? Some others ask, what is mental illness? How do you distinguish between a normal and an abnormal person? And some others ask, why does a person develop mental illness? What are the reasons behind that? We shall address these three fundamental questions and then move forward. So what is mind? So when the term mind comes to our mind, a lot of things appear. Emotions, thoughts, memories, perceptions, all these are different aspects of the mind. So is the mind located inside our body or is it located outside? I shall tell you a small story which may give you an idea regarding the location of mind. The story happened more than a century back in the United States of America. It happened in a place where a group of laborers were trying to build a railway track. This railway track construction operation was happening in a forest with a lot of large rocks. They were supposed to use crowbars to dismantle the rocks, then create a pathway and build the railway track. So there was a young gentleman in that group by name Phineas Gage. Phineas Gage was a very enterprising, enthusiastic, empathetic human being. He was a very nice friend. Whenever anybody else has got a problem, Phineas Gage used to go out of the way to help them. If anybody has got a health problem, he used to be the person who used to volunteer to take them to the hospital. He was very kind, compassionate, and considerate towards females and children. He was very dignified gentleman. However hard you tried to provoke him, he never used to get provoked. Such a well-balanced gem of a person. One day in the afternoon, Phineas Gage met with an accident. It happened like this. A group of laborers were going through the forest, just near to a large section of rocks. One person was walking in front. He had a crowbar on his shoulder. So while that person was walking, the crowbar accidentally touched the rocks. Some fire happened. As a result, there was an explosion. The rocks exploded. And to save oneself from that explosion, that person jumped. As a result of that jumping, the crowbar just went out of his hands and it went and fell down with the sharp end upwards. Phineas Gage and a group of laborers were following this gentleman, and when the explosion happened, they also jumped to save their life. Unfortunately, Phineas Gage fell on top of the crowbar in such a way that the crowbar, the sharp end of the crowbar, pierced his skull on the left side and came out through the right side. The front aspect of the skull was pierced. His co-workers took Phineas Gage to the nearby hospital. Sophisticated facilities were absent at that point of time. With whatever facilities there were available, the doctor treated him, took out the crowbar and rescued him, treated him with whichever medicines were available. Phineas Gage had difficulty in walking. He had difficulty in standing up. He had to rest at his home for 1 month, and after a period of rest for 1 month, he recovered completely. He gained his physical strength and he came back to work. Everyone was happy that Gage was back to work. But what happened there was really incredible, because the behavior of Phineas Gage had changed beyond recognition. Phineas Gage, who happened to be the most dignified, compassionate, empathetic, and well-balanced gentleman among that crowd, was behaving in a totally different manner. He was showing noise intolerance. When the sound of the rocks being punctured was heard, he used to just close his ears and shout, "Please stop that noise." When somebody tried to provoke him by cracking a joke, Phineas Gage was so enraged that he assaulted that person to the level that others had to intervene to save that man. On seeing a couple of females walking through the road, Phineas Gage went to them and was showing obscene gestures and was singing vulgar ballads in front of them. And what surprised the co-workers most was that one day in the afternoon, when all of them were working, a co-worker of Phineas Gage, who was located just near to him, just collapsed on the floor with a syncope. Usually in such circumstances, Gage used to be the person to help him, to rescue him and take him to the hospital. But at this point of time, Phineas Gage was continuing his work totally unaffected, totally not bothered about that person who had collapsed. Others came running and some of them asked Gage, "Hey, somebody near to you has collapsed. Didn't you see him? Are you not human being enough to help him in some way?" And Phineas Gage looked at them and told them, "Why should I help him? He's not related to me. Why should I bother about his life? I would be comfortable doing my thing. I'm not bothered about these things. I don't want to improve the country." So this statement was very much unlike the previous behavior of Phineas Gage before he had sustained that accident. Phineas Gage was investigated upon for his behavioral change. Imaging of his brain using X-rays was done, and it was identified that the part of the brain which is located in the front part, that is known as the prefrontal cortex of the brain. This prefrontal cortex is especially important for lawyers. I shall come to that subsequently, because there is a confusion nowadays regarding what sort of punishment is to be given to minors, especially in the background of the Nirbhaya case. So prefrontal cortex and its development has got an important role in deciding the maturity of a person regarding whether he is an adult enough to receive punishment. I shall come to that later. So as a result of the crowbar injury, Phineas Gage's prefrontal cortex was damaged. And it was as a result of that Gage was showing a different behavior or abnormal behavior. Investigations were done on so many people after that in the coming decades. People who had met with accidents, who had tumors in the brain, who were operated upon for issues in the brain, and who had degenerative dementias in the brain. Various kinds of imaging studies came up. Later, CT scan came, MRI scan came, PET scan came, so many imaging studies. And it was identified that damage, either structural damage or functional damage to any part of the brain, produces behavioral problems. As a result of these observations, modern medicine reached a conclusion that mind is nothing but the higher function of the brain. Mind is nothing but the higher function of the brain. So what do you mean by higher function? There are basic functions of the brain like hunger, thirst, sexual drive, aggressive instincts, which every animal is having. Human beings also do have that. But what is the difference between a human being and an animal? Most of you might have seen a lion, which is located in the zoo. The lion would be sleeping for most part of the time. After some time, the lion would wake up, it would have its food, and immediately after having food, lion would have sex with its female partner. The onlookers may record that in their mobile cameras, but lion is unbothered. It continues with that act. Will a human being do anything like that in a public place? It is unlikely, because human beings have this capacity to control their emotions. So this ability to control emotions is located in the prefrontal cortex. In animals, the prefrontal cortex is not well developed. That is why they act on the spur of the moment based on the emotions they experience at that point of time. But human beings have the ability to control emotions and postpone the expression of emotions thanks to the prefrontal cortex. Again, have you seen any animal starting an account in any bank? Starting saving money or anything like that? No. But human beings do so. What is the reason? Because human beings are bothered about the future. What if an accident happens to me after 6 months? If I am injured, if my leg is fractured, I should save something to smoothly sail through those moments of crisis where I may not be able to go and work on a day-to-day basis. So this planning and programming for the future, that is also determined by the prefrontal cortex. So these are the higher functions: the ability to think about the future, the ability to control oneself, the ability to analyze the relationship between an event and its consequence, everything like that. So these are what you call the mind, and mind is nothing but the higher functioning of the brain. Now let us come to the second question. What is mental illness? Mental illness, the definition of mental illness is very different for you and us. Legal definition and medical definition, slightly different. I shall come to that also. So, is anger a mental illness? How do you regard it? All of us do become angry. But do you consider it as mental illness? Obviously not. But a person becomes angry, and to control his anger, he goes to such an extent that he violently assaults his wife and murders her. Then only his anger is getting contained. Then do you call it as a normal behavior? Definitely not. The happiness is again a very normal emotion. But a person who becomes happy is running around the road without clothes. Do you consider it as normal behavior? Sadness, very normal behavior. All of us go through that. But a person who becomes sad climbs on top of the 10th story of a building and jumps from there, commits suicide. Is it normal? It's not. So what is the boundary between this normal and abnormal behavior? We can say that a behavior or an emotion can be regarded as mental illness when it produces socio-occupational dysfunction. If a behavior or an emotion of yours goes to such an extent that your normal day-to-day interactions with others is disrupted, your life partner is not comfortable staying with you, she is afraid that you may kill her at any moment, your co-workers are not comfortable working with you because they say that we are worried whether how this person would behave in a certain situation is so unpredictable. Ability to do the job is also impaired. So if that occupational functioning and social functioning are impaired or disrupted due to your behavior, then you can call that state as mental illness. Now, why does a person develop mental illness? Let us come to that third point. So many people say that stress is the reason for mental illness. Is it true? Let's take the case of two girls, college students, who have appeared for an examination. Both of them failed in the examination. The first girl, sad, definitely, sits at her room, not interested in giving face to her relatives or talking to her friends. But within 2 or 3 days, she overcomes that. She starts going to college, she starts mingling with others, and within a week, she is back to her normal self. The second girl, once the result is out, she locks herself up in her room, doesn't come out, doesn't have food, doesn't sleep, and on the third day morning, she is found hanging from the ceiling fan. Both these girls suffered from the same stress of failure in an examination, but they behaved very differently. What is the reason for this difference? So to explain this phenomena, we use a particular hypothesis which is called two-hit hypothesis. TWO2, HIT, hit, and hypothesis. So it's a metaphorical one. So if we receive a huge hit on the side of the head, definitely you would feel disturbed, but within few minutes you would recover. If we receive a huge hit on that point itself, again, one more hit after a minute, what would happen? It is likely that we may collapse on the floor. So just like that, if two different kind of reasons happen in the life of a human being, he can develop mental illness. And what are these two different kind of reasons? The first reason is biological predisposition to develop mental illness. Certain people are predisposed or more likely to develop mental illness from the time of their birth itself or from the time of their early age itself. There are certain factors which point to the possibility that you may develop mental illness in future. What are those biological factors? Obviously, the number one is your heredity, genetics, your family history of mental illness, as you call it. Don't misunderstand me. Don't think that just because a person has got a mental illness, all his children will be developing mental illness. It is not like that. All chronic illnesses, whether it is diabetes, heart disease, cancer, Alzheimer's, mental illness, all these have got a minimal genetic basis. I shall explain it with an example. most of us might have seen mentally ill persons on the road, wandering mentally ill persons who go without a proper clothing, disheveled, poorly groomed, with a long beard, not brushing the teeth, not taking bath, muttering to oneself or smiling to oneself, self-absorbed in their private world, not bothered about the world outside. So this condition is only one of the 100 different types of mental illnesses described by the WHO. The name of this illness is schizophrenia. So schizophrenia is very important to criminal law, so I shall come to that later. So if I don't have a family history of schizophrenia, my father or mother don't have that illness, still I have got a 1% chance to develop schizophrenia. If either of my parents, my father or my mother, one of them had schizophrenia, then I have got a 10% chance to develop schizophrenia. If both my parents, both my father and mother had schizophrenia, then I have got a 40% chance to develop schizophrenia. The good thing is that even if two people with schizophrenia marry, if they have 10 children, only a minority of them would be having schizophrenia. The majority of them, 6 of them, will be disease-free. But that 40% possibility compared to the 1% possibility in a person without a family history of mental illness is 40 times high. So why am I talking this to you? You should go and talk this to some medical students. Why should you talk this to me? I'll give you an example of a case which I had to encounter a year back. It was an engineering student, first year engineering student. After his first semester exam, he went out to have some fun with his friends. And a close friend of him prompted him to use cannabis or ganja or stuff or weed or sami or whatever it is called in your local parlance, depending upon the region. So he tried cannabis. It was the first time in his life that that 18-year-old gentleman was trying cannabis. He just smoked one puff and he felt that something was different around him. He thought that people were looking at him in a very different way. He thought that the watchman standing at the gate of the college was having an intention to kill him. Suddenly he became violent. He ran towards the watchman and started assaulting him. So all the friends went behind him, caught hold of him. He was really berserk. He was going berserk. He was extremely violent, unmanageable. He was caught hold of them, and after tying his hands and legs, he was brought to a hospital. And when he was brought to the hospital, he was in a totally psychotic state. He was wailing aloud that the watchman and the principal of the college were trying to kill me. They are trying to poison me and things like that. So all these things were mentioned. So he was suffering from what you call cannabis-induced psychosis. It's a disorder of the brain which happens when you use cannabis. So we treated him. He improved after 1 week. He was about to be discharged. And at the time of his discharge, I told him, Monet, do you know why this problem has happened to you? So, you know that it's the result of a substance use, isn't it? So this gentleman was asking me a question, sir, my friend Kuttappan, he has been using the same stuff every day, thrice a day for the last 1 year. Why he hasn't developed any illness? Why only me? The answer is very clear. Fortunately for Kuttappan, he doesn't have a family history of mental illness. But this index person, this boy's mother, is a patient of schizophrenia. She is under my care for the last 7 years. The problem is that the last time the mother had a major episode was around 8 years back when this boy was really small, and he doesn't remember that. Since then, she is on regular treatment. She is taking one single tablet right now. She is employed. She is a central government employee. She is working wonderfully well, and she doesn't show any evidence of any illness right now. But the problem is that the possibility to develop illness has been inherited through the genes. And when this cannabis was taken, that possibility, that vulnerability was manifested. So that is the reason why he showed the signs of illness. So this message is very clear. If you have a family history of mental illness, stay away from all drugs of abuse, including alcohol or cannabis or anything, because there is this, propaganda going around in social media that cannabis is something wonderful for your brain. It's not like that. Cannabis is brain damaging. It produces mental illness. It produces psychosis. So these are certain biological factors, genetic factors, problems which the mother has encountered when the person was in her womb. Malnutrition in the mother, illnesses of the mother, problems during delivery, and even after childbirth, if the child sustains an injury to the head, or if there are certain hormonal problems like thyroid problems in the child, all these are biological factors which make a person vulnerable to develop mental illness in future. And the second hit, or the second reason, as you call it, these are the stressful life events as we call it. So anybody with a biological risk factor, if he faces a small stressor itself, he can develop mental illness. For example, a person with family history of schizophrenia, by smoking just a puff of cannabis, he develops schizophrenia. A person with a family history of depression, by just breakup of a love affair, he can develop depression. But if you don't have a family history, if you don't have any other biological risk factors, you may be able to overcome even bigger stresses in life. So that is what is called the two-hit hypothesis. So I have answered three fundamental questions. What is mind? What is mental illness? And why does a person develop mental illness? Of course, I get a couple of questions in the chat box. Even though I am continuing with my talk, I may address one of those questions which is asked in the chat box also, because it is very relevant to the conversation we are having right now. Many people develop clinical depression during the academic period. Even after taking medications and consultations, in many cases, it reappears. So the thing is that if your leg is fractured, the doctor advises you to put a plaster for 6 months. If you remove the plaster by yourself after 4 months, what would happen? The fracture is not completely healed. So when you walk with that fracture which is not completely healed, a small stress or a small pressure on that area, the leg again breaks, the bone again fractures. So what happens in our part of the world is that people don't take medications for the adequate period of time. So taking medications properly for the adequate period of time without break even for a single time, that is the key to success. So let me discuss what is about depression. So regarding depression, depression is a very common phenomena. I want everybody to understand what is depression so that you can help somebody, which is your colleague or a family member with depression. Depression is very different from normal sadness. We all suffer from sadness when something bad happens to us. But a clinical depression is a condition in which there are 9 symptoms. Number 1 is continuous long-standing sadness. The person is feeling sad right from morning till evening, irrespective of the situation, not related to a person or a scenario. Second is reduced interest in doing previously pleasurable activity. Person who used to study well, mingle with friends, go out, do exercise, watch movies, is no longer interested in anything like that. Third is unexplained tiredness or unexplained fatigue. He feels so tired during the day, doesn't feel like getting up from bed. Sleep disturbance is the fourth one. He wakes up at least 2 hours before his usual time of waking up and is unable to complete the sleep. Appetite disturbance. You don't feel like eating even your favorite food items. Concentration impairment is the sixth one. You want to focus on something, but just like waves in the sea, so many thoughts are being bombarded in your mind. You're unable to single out one and focus on that. Slowness of thoughts and slowness of actions. That is the seventh one. Somebody asks you a question, you are unable to answer that question. And somebody tells you to do something, but you are incapable of doing that. You take a long time to do that. So this is what is known as psychomotor retardation, as you call it, slowness of thoughts and slowness of activities. Then we have got depressive thoughts, feeling of hopelessness, helplessness, worthlessness, a feeling of inappropriate guilt, all those things. And the ninth symptom is death wishes and suicidal ideas. So out of these 9 symptoms, if at least 5 are present for a period of 2 weeks continuously, that is major depressive disorder, Vishada Rogam, as you call it in Malayalam. So there are certain neurotransmitter correlates in the brain which lead to these issues. There is a chemical called serotonin in the brain. When the level of serotonin goes down, you feel sad, you feel that there is nobody to help you feel there is no future for you, you feel suicidal. When the level of norepinephrine goes down in your brain, you feel fatigued, tired, lack of energy, things like that. So if the depression is mild, just by psychological treatments like talking to the person, we can bring him out. If the depression is severe, you need medicines. We have to correct the level of the neurotransmitters in the brain. We have to give medicines which improve the level of serotonin and norepinephrine. And in first episode depression, you have to take medicines for 9 months. So if you take medicines for 9 months, in 90% cases, the illness is completely cured. You can stop medicines. But what happens in our country is that after 2 or 3 months of medicines, the patient and the relatives decide that all is well, no more medicines are needed. They stop medicines. So the scenario is like a fracture which hasn't completely healed. So what happens? The next small stressor comes, they develop depression again. So that is the problem. So proper treatment with strict adherence to medicines is the key. In such cases, most of the cases of depression completely recover without any doubt. So family relationships and the connection with psychiatric problems, definitely a good family life is very important for every human being. So a supporting family life. So it is in this context that I'm introducing two terminologies to you. Number one is mental health literacy. Mental health literacy means an awareness about what is mental health, how to identify a person with a mental illness, and how to support him. And the second term I want to introduce here is mental health first aid. This mental health first aid is extremely important to all of you because we have heard about first aid. If a person develops an accident or is bitten by a snake or falls down, some intervention which a person without any medical training can do before he is taken to a hospital is called first aid. But we haven't heard about mental health first aid till now. But in 2016, the World Health Organization recognized that students should be trained in mental health first aid to identify and help those people with mental health issues, either in their school or at their home or at their locality. So there are 5 steps for mental health first aid, which every person should understand. Number one, you have to, if you feel that a friend or a colleague or a family member or a neighbor is distressed, is behaving different from what he used to, you have to go proactively, approach and inquire what is troubling you. So actively approach the person in distress. That is the number one. Because many of you are in the adolescent age. I guess that you don't feel like opening up your troubles to seniors, your teachers, your parents, etc. Because you are apprehensive whether these people will understand you. So how do you convince a person to make him open up? There are 5 things to be taken care of. You should convince him that you would listen to him completely. You would convince him that you would take his problems seriously. You would convince him that you won't make fun of him for his problems. You would convince him that you won't scold him or regard him in bad light because he has revealed his problems. And the 5th thing is that you should ensure and convince him that you would keep it confidential. If you are able to convince these 5 things, it is sure that that person may open his mind. So that second step comes, listen. Listen to the person who is trying to talk to you. Patiently listen. Non-judgmentally listen. Don't criticize him. Don't make fun of him. Maybe he is talking to you about a sexual issue which you cannot relate to or which you cannot understand by virtue of your ethical points of it. Still, it's your duty to listen. Listen completely. That is important. So listening itself may take off some stress from the mind of that person. Then we come to the third step, give information. Maybe he is stressed due to some misconception. If that is the case, correct the misconception. He is worried that a classmate of his is not talking to him. So I think he is mad at me. He is not friendly to me. That is the reason. You can tell him that it is not the reason. You can tell him that that person is stressed due to certain domestic problems of his, so that he is not in a position to talk to anybody at all. That is the reason. Tell that, clear that misconception, then he may feel relieved. Still, even after correcting misconceptions, if still the problem is persisting, then that is a serious problem which requires some attention. That is the fourth step. Encourage professional help. In that case, encourage that person to consult a mental health professional. Tell his parents, inform his parents that he needs help. And together, all of you should help him to get the appropriate professional help. And then the fifth one, the most important step, that is encourage social support. So what is the social support? There was this wonderful study which was started in Harvard University in 1938 that is called the Harvard Human Development Study or GRAND study. It was conducted on students in Harvard. It is still being continued. It is 82 years. Thousands and thousands of people have participated in that study. Every detail of their life, right from their childhood till their death, is meticulously followed up and assessed. So the Harvard study has put forward 5 important factors which prolong the lifespan of a human being. Number 1 is proper exercise. Number 2 is regular diet. Number 3 is abstaining from alcohol. Number 4 is doing away with all tobacco products. All of us know these things. But there is a fifth factor. The fifth factor is the factor which prolongs life much more than the other 4. The most important factor which prolongs your life. That is nothing but the quality of human relationships you develop in life, especially during your childhood and adolescence. This is a very important eye-opening phenomenon which the Harvard study has shown. So it re-emphasizes the importance of a healthy family life. So supporting each other, maintaining a cordial relationship. Parents should have a cordial relationship with each other. Parents should have a cordial relationship with children. Children should have a space to open up their mind in front of their parents. A quality time of 30 minutes every evening in which parents listen to the children. It's not the time for parents to advise their children. It's the time for children to speak their mind and for parents to listen. It's very important in maintaining a positive mental health. So again, we have got the problems in visual media. Addiction to mobile phones, addiction to computer, laptop, tablet, iPad, everything like that. Right from the beginning of the COVID pandemic, we used to receive a lot of videos from Italy, which people, suffering for oxygen, breathing their last, very traumatic moments. They used to be circulated in visual media. People were petrified, they panicked. So actually, this phenomenon, post-traumatic stress disorder as you call it, when you yourself undergo a life-threatening or an image-threatening phenomenon, or you witness such an event, you feel extremely dazed and confused. That is called PTSD, post-traumatic stress disorder. Definitely, there are treatment methods available for that. Relaxation training to reduce the level of the autonomic activity of the brain. Cognitive behavior therapy to correct the negative faulty thoughts in your brain. And if it is so intense, certain medications also to correct the level of neurotransmitters in brain. These help a lot, and that helps a lot in containing the problem. So I'm coming to the last few minutes of my presentation. So we have mental illness. The problem is that the definition of mental illness in medicine and law are very different from each other. So the legal definition of mental illness and the medical definition of mental illness are very different from each other. So what does the law say about mental illness? Indian Penal Code section 84 says that nothing is an offense which, when committed by a person by reason of unsoundness of mind, is incapable of understanding the nature of the act that is doing, or whether that act is wrong or contrary to law. So only a few mental illnesses subscribe to this category of the legal definition of mental illness as per IPC 84. So there, schizophrenia, dementia, or illnesses in which a person is incapable of understanding what he is doing or regarding the realities of his action. But there are a lot of mental illnesses who don't belong to that category, like depression, anxiety, stress, so many things. They don't fall under the category of IPC 84. So let me wind up this session by quoting a small experience of a world-renowned psychiatrist, Dr. Viktor Frankl. Viktor Frankl was a person who was imprisoned in concentration camps during the Second World War because he was a Jew. When his life was taking off, he was a young doctor who had a very good practice. He had married his childhood sweetheart. When everything was set for a very happy life, he was caught by the Nazi soldiers and imprisoned in concentration camp. But thankfully, he escaped after the Second World War. He was alive to come out of the concentration camp. He resumed his practice, built a huge reputation, wrote some books, became world famous. Towards the fag end of his life, an experience which he told. He was about to go to bed one night. It was midnight and his phone was ringing. When he picked up the phone, it was a lady, a young lady who was not known to him. That lady told him that, "Sir, I am depressed. I want to commit suicide." Frankel asked her, "What is the reason?" And she told so many things. Frankel spoke to her for over 1 hour, gave her reason after reason, convinced her about the importance of living in this world and not committing suicide. And finally, that lady told him that, "Okay, sir, I don't want to die. I refrain from committing suicide." Frankel felt happy and he hung up the phone. After 3 months, when Frankel went for a public function and he was returning from there, a young lady came to him and met him. "Sir, do you remember me? And that lady who called you 3 months back, threatening to commit suicide. You spoke to me and I am alive." Frankel felt really happy and he asked her, "I had mentioned so many reasons why you should live in this world. Which one of those reasons prompted you to live and not commit suicide?" That lady looked at the eyes of Frankel and told him, "Sir, it was none of those things." "Then what?" Frankel was surprised. That lady told him, "Sir, it was the fact that a human being who had never seen me in real life was patient enough to give 1 hour of his time at midnight to listen to me carefully and talk to me out of my distress." So a world in which a person was willing to listen to me seemed to be a world worth living. And that's why I'm here, I'm alive. This is a very wonderful message which all of us should imbibe. It's not the brilliant words of wisdom or the philosophical discourses which we make, which prompts a person to positivity. It's just our mere presence, our patience, our willingness to listen, our willingness to lend a helping hand. So on this evening, I request each and every one of you to take a leaf out of Frankel's book. Be supportive to each other. Be supportive to your family members. Understand the distress. Do psychological first aid. Guide them out of the problems and stay with them. Be of benefit to them. That would be an extremely fulfilling experience for your life. That would give your life a sense of purpose. And that itself may prevent you from getting addicted, depressed, or aggressive in life. So once again, thank you very much for this great opportunity. Thank you.
Thank you, sir.
Thanks a lot, sir. Hello.
Yeah, yes. I think there are a few questions in the chat box. Shall I start answering them?
Yes, sir. Yes, sir. There are a few questions in the chat box.
Shall I
Can
answer?
you answer them?
Yeah, definitely, because I'm supposed
Okay,
to
sir.
leave by exactly 5 p.m. I have to join for an emergency meeting in my hospital at 5:15. So I have to log out at 5 exactly. So I'll answer the questions straight away.
Okay, sir.
So
Okay.
first question is regarding deterioration of family relationship has any connection with increasing psychiatric problem among youth? Definitely. A supportive family environment is very important for a positive mental health. If you feel distressed, if you have somebody to open your mind to, that's relieving. And an understanding family member who supports you, helps you, and if necessary, takes you for a treatment and helps you out of that distress. That is very important. So domestic conflicts, parental conflicts increase the prevalence of psychological problems among children and adolescents. That is definitely true. So the next question I have already answered regarding clinical depression. Thing is that proper treatment for 9 months with strict adherence to medicines and therapy without break even for a single day. I underline the last part using 2 lines. That is most important. So those things would help people out of depression most probably. So the third question is regarding the role of audio-visual media in PTSD. I think that also I have just mentioned in my talk. Definitely, visual media has got a very important role in our life. Addiction to digital gadgets is very important. In online classes also, it is creating problems because students log into online classes, then open another window and start playing games and things like that. That is happening right from school students itself, and parents and teachers are worried about that. So judicious use of visual media, that is very important. So judicious use because it should be healthy use. Of course, using mobile, computer, etc. for 1 hour per day is okay. It is the healthy use. If you use it for more than that, if it runs to several hours, the coordination between the left and right hemispheres of the brain is lost. Your concentration is disturbed. Your sleep is disturbed. You become stressed. You may become depressed. So healthy use and judicious use is important. So how can one overcome negative thoughts and overtension? There are several methods to overcome negative thoughts. Number 1 is practice something called positive psychology. So there are 3 simple steps in positive psychology which we say. Number 1 is 3 blessings. At night before going to bed, write down 3 happy events which happened on that day in your life. Read that and then go to sleep. Number 2, after closing your eyes when you go to sleep, think about a pleasant childhood experience which happened before 10 years of age. Go back in time. Feel frozen in time at that point of time. Experience those emotions and go to sleep. And third is at least once in a week, think about somebody who has helped you in any way in your life, who was not supposed to help you by virtue of his responsibility, but he went out of the way to help you. If that person is alive, contact him, express your gratitude. If that person is no more, write a letter expressing his gratitude. These are 3 simple tips to overcome negative thoughts and overtension. But if it is so much stressed, you should get a professional help. There is something called cognitive behavior therapy, which helps to correct the negative thoughts in the brain. If it is so problematic, even medical treatment will help. So problems created by the teenagers or the behavioral changes by them creating distractions in family, definitely. It's a very important problem. The most important reason is the lack of communication between teenagers and their parents. Once the children go into teenage, the parents, most of them feel that children don't have any emotional needs. They feel that only the academic needs need to be taken care of. So they distance themselves from children, talk only about studies and academics to the adolescents because the parents are confused regarding how to handle them. So this creates a stage of emotional vacuum in the minds of teenagers because even though teenagers appear to be grown up like an adult, they are still children who crave for affection. So that important aspect should be understood and bridged. If that is not attended to by parents, they'll go for or they'll seek affection outside the home. And the person who extends affection outside the home need not be doing it at the best interest of the teenager. That's the problem. So persons suffering from premenstrual syndrome more prone to commit crime like assault, suicide. Of course, premenstrual syndrome is something which happens in around 30% of females in 1 week prior to the menstrual periods as a result of the hormonal fluctuations. They feel sad, irritable, distressed. Of course, there are situations in which they have committed self-harm and even harmed others, but it is an easily treatable condition. Easily treatable condition. Simple treatments can help to contain the symptoms of premenstrual syndrome. So if it is producing distress, if it is producing too much of stress, consult a psychiatrist, get it cured, and simply it will be contained. So the next question is, I have seen changes taking place in some of my friends who watch certain series, of course. Series and also certain games, online games also. So it's not because they are mentally weak, it's because they suffer from something called social disconnection syndrome. So the series we see is a piece of fiction, or at the most, it's a virtual reality. It should be just a part of your life. You should have an active social life outside that. I always talk to children that you should maintain at least 5 different group of friends. One group of friends at your college, one group among your school friends, one group in your neighborhood, one group among your relatives, then one group in your social circle, like church or temple or wherever you go. So if you have these different groups of friends, we'll talk to them obviously at least once in a while, and that will give you a reality orientation about life. But if you cut yourself from others and you focus, you get addicted to these series, then you will start empathizing with the characters of that series. So if you have got a lot of friends, if you talk to them also in between, you understand that the series is just a fiction. People are not like that in real life. So that is what is important. So remain socially connected. And the most important thing which we tell right now is not social distancing. It is physical distancing with social connect. ശാരീരിക അകലപാലനവും മാനസിക ഇടയെടുപ്പും. That should be the thing of the person. So all the questions have ended. I think I have
Thank you.
said everything, and my time is also running out. So
Yes,
thank
sir.
you.
Thanks a lot, sir. I would just invite Hridya ma'am, our coordinator, to deliver the vote of thanks. Thanks a lot for this fruitful session, sir, and to remind us that we need to be kind to our mind. Over to you, Hridya ma'am.
Okay, a warm good evening to one and all. It's my humble privilege to express a vote of thanks on this occasion. On behalf of Srinarayana Law College, Putota, and myself, I extend my sincere gratitude to our most honored resource person, Dr. Arun B. Nair. Sir, we are much obliged to you for the scholarly presentation on the topic of mental health and also for your kind indulgence in the presentation. I am immensely thankful to our esteemed principal, Dr. Raghunathan sir, for your continued guidance and encouragement. I express my sincere gratitude to our respected manager, Sri Ajimon sir, for the support in all our actions. I extend my heartfelt thanks to our beloved Vice Principal Sindhu ma'am and IQAC Coordinator Priyanka ma'am for the continued support. I convey my sincere thanks to all my colleagues, students, and all the participants for the continued cooperation throughout the webinar. Last but not least, I would like to mention my high appreciation to the student coordinators Tanya Tom, Siddharth, and Anandakrishnan for their efforts to carry out this seminar. Once again, thank you very much to one and all.
Thanks a lot, sir. Dear participants, we have come to the end of the session. This was indeed a fruitful session. Thank you all for making this session a wonderful success. The feedback form has been put up in the chat box. Kindly fill the form and you will be receiving your certificate. Thank you.